As practicing physicians, we recognize and embrace the need for effective, responsible healthcare reform and believe that our experience and perspective must be considered by Washington policymakers. Using political rhetoric, misinformation, and deception by a compliant national media, bureaucrats are unfairly criticizing the quality of American healthcare and patient outcomes in order to control the entire system. Despite these efforts, the majority of patients recognize that American healthcare is the best in the world, the most compassionate in the world, and dominates as the leader in technology and innovation.
Yes, there are problems that need to be addressed, primarily with access to affordable health insurance, increasing costs, and an out-of-control medical liability system. The good news is there currently exist many common sense and inexpensive solutions to these issues. However, they are being ignored by Congress and the White House. Here is Docs4PatientCare's prescription for effective and responsible reform that will help address these three major issues while limiting government's involvement in our personal health care decisions.
Access to health care insurance is a chronic problem for 15 to 20 million American citizens. This can be addressed immediately by providing insurance vouchers and tax credits to be applied towards the purchase of health insurance using one of the existing 1,700 private insurers. The cost of health care insurance is high and needs to be made more affordable. This can be accomplished by promoting competition in the marketplace. Here are some methods to do this.
We must repeal the antitrust exemption that favors insurance companies, allowing them to collude and which results in higher premiums.
Let's eliminate pre-existing condition penalty by expanding high-risk pools across the entire nation so these patients can join millions of others and will force insurance companies to compete for their business.
Finally, we should allow individuals and families to purchase their own health care insurance across state lines and receive the same tax benefits as their employers do now. This will achieve two things. First, it will uncouple insurance from the workplace, therefore making it more portable. And two, it will enable people to own their own insurance policy.
Additional solutions to make health insurance more affordable would be to eliminate state mandates, antitrust regulations, and other government rules and burdens which inflate the cost of health care. Allow doctors and hospitals to publish their fees and rankings so patients can price their health care like they do other services. Encourage health savings accounts, which will make patients more informed consumers of health care resources and reconnect with the actual cost of medical care. Finally, the cost of medical liability to the American healthcare system is estimated to be $400 billion per year, which adds $2,000 to each family's insurance premium. With responsible tort reform, we could still protect patients' rights, yet save enough money to pay for the many suggestions like tax credits and insurance vouchers.
Unfortunately, the legislation being proposed by Congress will do nothing to address these problems. In fact, the result of this politically expedient and ill-conceived plan will be increased expense. Millions of Americans will still remain uninsured, and we will set unprecedented massive increase in taxes and the federal deficit. While members of Congress calculate the political fallout and engaged in closed-door deal-making to get this bill passed quickly, the two most important stakeholders, you the patient, and we, the nation's practicing physicians, are being left out of the discussion. Practicing physicians have serious concerns about the health care reform bills being railroaded through Congress. Please do not be misled by the AMA's endorsement and last week's White House photo op with a group of physicians personally selected by the President, as these groups do not share the opinion of the majority of physicians.
Doctors alone cannot alter the dangerous course this legislation will take American health care. We need your help. If you desire health care reform that is responsible, affordable, and sustainable while preserving the doctor-patient relationship and your freedom of choice, please do the following. Call, email, and fax your 2 U.S. senators and U.S. representatives and tell them, slow the pace of this debate. This legislation will affect the life of every American, so they need to proceed with care and caution. Tell them to vote no on any vote for cloture, which would end further discussion and bring this bill to the floor for a vote. You also reject any bypassing of normal congressional protocol to pass this legislation quickly into law before the public and minority party can scrutinize the bill. The President promised transparency and accountability, and you expect all lawmakers to keep that pledge.
We will all be patients someday. It is up to every one of us to act now to help guarantee that a modern, efficient, high-quality healthcare system will exist when we need it.
For more information, please visit www.Docs4PatientCare.org.